This week on the Post Call Podcast, we are talking all in kids play it. What should you tell parents in the clinic? What should you tell parents about it? And what you should tell parents about other sports. We're also going to talk about the NFL's Crucial Catch campaign and how it is a really good awareness campaign, but there is a doctor out there that thinks that maybe there are some caveats to that. And spoiler alert, she is a co-host of this podcast. Dr. Emmy Okamoto, thanks for coming back this week. And I heard that you almost died, that you were attacked by vicious animals.
No, I didn't die, but this morning I found out ants got into the cat food, and there must have been hundreds of them.
Hundreds of ants.
Hundreds. Yeah, it was just like a mass eradication that happened at my house this morning.
So, and
they're tiny though, the teeny ones.
But the cats were like, hey, so I mean, I know we could do it, but like our food, bro, like please.
Yeah, they just pick the food up and shake it off and keep eating.
They're like, oh, all right, well, that's good enough.
Yeah.
Welcome to the Post Call Podcast. I am the host, Nick Andrews. I'm the voice of MDedge Podcasts. Before we get going, we have a survey that will help us improve the podcast. We want to know what specialty you are, just basic things like that. And I know it's annoying and everybody hates surveys, but please consider doing that. It really helps us out, and it will help us get more content and interviews that are relevant to you. You can find that in the show notes. But I wanted to kick it off this week, LOL, because it's football, with something that's not football. We're going to talk about pups, and it appears like having a dog just might add years on your life. Emmy, is that true?
Dogs. Yeah. Recent study that having a dog decreased your risk of premature death by 24%. And there's a lot of studies that kind of contribute to this: lower risk of stroke and heart attack, lower blood pressure, lower cholesterol, in part because you're walking your dog more.
Right. But
also there's something special about just that connection and what it means for people and their health.
Yeah.
What do you think, Nick?
So I had my first pet ever recently, and she was a pup, and she died earlier this year. And I'll first of all say the devastation that goes along with that was something that I completely underestimated. But I will also say that was like my first best friend. You know what I mean? But I get it. It definitely, it's rewarding because the love is unconditional, but you also have to be responsible, and it's weird that they're kind of responsible for you. Like, hey, I know you're really hungover today. Maybe you should get up and go for a walk or something. So dogs can really help out that way. It makes total sense, and we've seen similar research with regard to cancer. Having a spouse can, you find the lump on your back, and you find the melanoma earlier. So just having camaraderie, having passion in your life with other living things is statistically beneficial to your long-term health. And I think that if you have someone with loneliness or maybe needs some responsibility, I don't want to say it's an indication to get a dog, but it is an invitation to get a dog. And at CHEST, which is a huge meeting that just happened in New Orleans, it appears like dogs are helping to fight burnout. And our reporter, Therese Borden, our editor, Therese Borden, was there. Let's hear what she talked to one of the doctors at CHEST, and I think we have that sound right here. Let me see.
Carol, what do you think these dogs can do for chest physicians? On what day? Why should chest physicians care about these doggies?
I'm a huge believer in pet therapy in our hospitals. I'm an ICU physician, and I think that pet therapy, even in the ICU, is important. That was something I fought our infection control at our hospital about a decade ago, to keep pet therapy in the ICUs. I'm a pediatric doctor, so I'm particularly in favor of pets, but I frequently find when the dogs visit us at our children's hospital, the staff gets as much out of it as the patients. So,
do you find that your colleagues are worried about infection issues and
so I actually did a review on that and could not find that dogs pet therapy spread infections in any way. So no, I do not think that. I think if you take proper precautions and you don't let them into isolation rooms, there's no more reason why you can't have a pet there than a person.
Thank you, Dr. Carol.
Done. I would love to see dogs at my meetings, and they make me happier wherever I am. So especially for those people who don't get contact, they work too long hours or travel too much and can't have their own dog. It's so great to be able to touch one and have one for some short time even.
Yeah, no, I completely agree. They puppies relieve stress. I have found that watching movies alone, like in a movie theater, relieves stress. But dogs, they really can do that. And we are a pet friendly podcast. If you're allergic to dogs and cats, we encourage you to get a hedgehog or a fish or something. Just having something in your life can make a big difference. But we wanted to switch gears to the focus of this show in particular, which is the game of football and subsequently other games. The first thing I wanted to start off by saying, we want to talk about the Crucial Catch campaign. So the Crucial Catch campaign is something that the NFL started as a response to October being essentially Universal Western Hemisphere Pink Month for breast cancer awareness. This is Susan G. Komen. And when I was in college, we wrote I don't want to call it an expose. We were not exactly Pulitzer Prize-winning journalists, but we found that the money that it raises for Komen is not as much money as it makes for Nike. And you think breast cancer, but there are all these other cancers. Lung cancer awareness is coming, and colon cancer screening is directly correlated, similar to breast cancer, with really good long-term outcomes, et cetera, et cetera. So the NFL a couple years ago switched gears and said, it's not breast cancer, it's all of them. And if a player wore a color for a cancer, then the media, in order to get credentialed, at least for the first year, I don't know if this is still true, they were required to ask about it for the purpose of raising awareness. So if you were credentialed media at the press conference, say if it was Tom Brady and he was wearing turquoise, hey, Tom, what's the turquoise about? And then it would be on camera, and which is a really, really, really great thing. And I think it's a much better shift than just focusing on one cancer. However, there are dissenters among us. One among us
Thank you, Nick.
is slightly critical. Let's read this title. Published February 2nd, 2018. This is, of course, seconds after her hometown Philadelphia Eagles won the Super Bowl. The title says, think critically about for-profit donor entities and their commitments to health. And this is, of course, as you and I had discussed when you and I first met, the NFL is not a beacon of an employer prioritizing health of its employees. So what are you talking about here back in 2018, and why were you critical?
Yeah. Well, I was working for a safety net clinic, and I agree there is some good with giving money. I believe it was $8 million, which the pot of the NFL is a drop.
Yeah.
But $8 million towards cancer. And so everyone in the clinic, every single person sported an NFL t-shirt except yours truly. But what it shows is that it's a huge marketing campaign. Yeah. And you have to think, what is the NFL in terms of the larger health? And that was at the time that they were still hiding, in my mind, actively hiding a lot of the research and trying not to really put forth a lot of the CT, the chronic traumatic encephalopathy. Yes. And you see this with a lot of different industries. You saw it with the beverage industry. The Coca-Cola did a Let's Move campaign saying, look, Coca-Cola doesn't contribute to obesity. It's that we're not moving enough. So let's get moving.
Right.
But that was actually, I think, retracted because people start realizing that this is
it's directly correlated with sugar. Yeah. No, you make a good point, and that's what we did when I was in college. Is like, hey, where's the money going? And we found, and this number, I don't know if it's still true, and don't quote me on this, but in 2014, schools that were sponsored by Nike, the percentage of profit, not of money, of profit that went to Komen was 15, which meant that Nike and the universities were pocketing a huge amount of money. Whoa. Where you're like, so 15, and the amount of money that Komen made was probably really good, but what it does is, and I mean, you could get into some weird gender stuff here with breast cancer, but it was kind of tugging at everyone's heartstrings, like buy the pink thing. And then I remember when I was in high school, we wore pink stuff, and it was just like the cool thing to do, support cancer. But now you're looking back like this was Nike and Adidas and some really smart people making a ton of money. So I commend the NFL for doing that, and I have a Crucial Catch shirt, and I know that I contributed to what you said, but also I find spending money is voting. And I want to vote for awareness that is spreading the wealth for other cancers. Because colon cancer is, the awareness campaign for colon cancer compared to breast cancer, to me, is problematic.
Sure. And you like the NFL.
And I'm a fan. Yeah. And I will say this, I hadn't bought a piece of gear in years. And when Crucial Catch came out, because of my work in oncology media, I was like, that, I can get behind that, and then the media having to ask about it was a really clever thing. And so I was all about that. But you're so right about this. So this is a title from ProFootballTalk.com. There's this offensive tackle for the Jets, Kaliki Osemele. He had not one, but two orthopedic specialists take MRIs and give opinions of the results of those MRIs regarding his shoulder and elected to have surgery. However, the team physician and the team officials said he's clear to play now, that he should play now. And so he elected to have surgery, and the team fined him for that, despite the two opinions of orthopedists saying that, no, you're eligible for surgery. So he had surgery. And this goes exactly to what you're saying, where they're not the good guys. This is an employee saying, I am eligible for surgery, and the employer saying, we're going to take your money. You should be out there playing, which is like, I don't want to use the S word, but it is a weird form of servitude to say, no, don't take care of yourself. You work for us. That was, and this is not the first time this has happened. It's particularly gut wrenching to read stories like this. So it proves your point as well.
Yeah. And it's all, we're all kind of in this mess of a corporate and donation and money and just find a place that makes you happy. So I agree. There is, silver lining to it, some good.
Yeah.
So just,
I mean, if you were him and you were out of this money, you'd be mad. And power to his union and his representation, and I'm sure that they'll get the fine back, and wish you health if you need shoulder surgery. You can't play football without a shoulder. Like, you got to get it. They have all these surgeries all the time. So yeah, but the game is born out of joy, which is learned when you're a kid. And as we're about halfway through or 2/3 of the way through high school and middle school football season, I think it's going to be the time when parents start realizing, wow, that ankle's been swollen for a couple weeks, and how's your head doing today? So we want to transition to what patients experience in the clinic, and not just football, but with all sports. So in your time in the clinic, how did you answer sports related questions?
Yeah, luckily my population, I didn't have a ton of them. Most of them would sit out, take their time, wait till they got better. But I think everyone sees a fair share of, especially this early sports physicals, clearing patients, getting them ready, deciding whether to do an EKG on that otherwise healthy young man.
And or woman, of course. It's something to pay attention to. I think that obviously, because it's football season, that's a sport we're paying attention to. As a sports nerd myself, it's statistically, I guess, and last time I looked was 2015, the highest likelihood for injury that required a procedure or missed time for adolescents was basketball in America. Soccer is associated with far more concussions than football. Hockey is associated with a lot of orthopedic injuries. So if injuries aren't going to deter you from playing, which is fine, something to be aware of, that none of them are safe, and ask the proper questions. I have a toe thing that is a toe thing because I ignored it for a while, and I'm probably eligible for an orthopedic surgery or podiatry, I guess, rehab. So I encourage people to raise your hand and say, or ask your patients, dive deep, like how's soccer going? How's your head? How's your elbow? How's your knee? Because that crap adds up, and then you find yourself at 29 years old thinking, when am I going to take time off work to get my stupid surgery?
Yeah. And the concussion thing is something that, you were saying soccer actually probably is more dangerous for your head than football, but it's not something we talk to our patients about because it's not perceived as a risk. It doesn't hurt. We're usually not knocked out, but physics-wise, think about the energy required to completely reverse the velocity of a ball going, 15, 20 miles an hour to negative 15, 20 miles an hour.
It's crazy.
It's like pool balls and your head's the cue ball or whatnot.
Absolutely. And the other thing about that is, especially with soccer, is that it's the concussions that when you see in football, a guy gets a concussion, he's knocked out cold, and it's violent, and it's hard to watch. But in soccer, they're not at that grade, but they are repetitive. I think that I know that people are more likely to get multiple concussions during post concussion syndrome. And I know that the CTE epidemic in Europe has been kind of under the radar. We've covered it a little bit here at MDedge Neurology, but soccer is one that definitely needs to be in the forefront. And depending on what state you're in, that's a sport that will start at different times. But all sports have these injury risks, and I think that it's really easy to kind of brush some under the table just because they're not football. Don't do that, because there are a lot of myths about it just because they're not playing on Saturdays and Sundays.
Yeah, and there was that recent by a medical student on Reddit. Would you let your kid play tackle football?
Yes.
Would you, Nick?
No, hard no, absolutely not. If the
From
kid,
someone who's played.
yep, and I played football, hockey, and I played sports all the time. There are two reasons. One reason is that the risk for injury, football injuries are, they're not worth the reward. If you were to make it to the National Football League and make a set amount of money, it's not the same money that you would make per the work that a hockey player would make, a basketball player would make, a baseball player would make. They don't value you. The career is shorter, so I'm not going to perpetuate that. And the second thing is, while there are a lot of other injuries that happen, high school kids die annually playing football because their bodies aren't ready enough for what their bodies are capable of doing, which is a weird thing to say, but they're faster than they are strong. They're not quite pliable enough at 17 to make up for their speed. The risk isn't there, but I follow this. There's a really famous football player, Clay Matthews. His dad said, nope, you're too small. You can't play. He's in the NFL now. He didn't play till he was 18. So if I had a man or a son who became a man and at college, you do whatever you want. You're a grown man, but I'm not signing the thing. So you can figure it out. But that's me. And I'm from the Midwest. I'm from the Rocky Mountain West, and I played football, and I say no way.
Yeah. Yeah. Maybe just eliminate the tackles early on. Yeah. There's a lot of discussion on how that can be done.
Sure.
And you're right, not only football, but a lot of sports.
Yep. And I'm as you know, I'm a big fan of sports. I think they can teach you camaraderie and teamwork and you know how to accept defeat and victory and all of that. So I'm a big fan of them. But these are really difficult discussions. They're not going to be handled by adults very well. So in the clinic and with children, I think it's a really good time to just be honest. Like, hey, you're having fun. You're a kid. Here's what could happen. I'm here for you always, no matter what. So our interview this week, Dr. Jeff Pearson, the reason we are doing football is because he's a family practice physician and he gets into sports. He's a huge sports doctor. He's also a bit of a strange guy. He does magic. He sings songs. He's got a cool little website, and he and I had a really great conversation. And what he told me was that it's important to have uniqueness and to break down barriers and to teach. He teaches things like sexual health and puberty to his patients by making them laugh. He utilizes magic and utilizes humor to make his patients laugh. So what do you think about having that unique thing to be memorable for your patient population?
That's wonderful. And I love the magic. I particularly think there is something quite magical about, having a trick right in front of your eyes. But that really is something to connect with patients, make them feel like they're, in a special place and just another way to let them know that you care about them and to build that trust. Oh, this is a really cute website.
I know.
Shameless plug for my wife.
He and his wife, Emmy, get this. They showed up for their first date, which was going to be a jogging date, and they were wearing the same outfit down to the color of their hat. Like, what are we going to do for a date? We're going to go jogging. And they were wearing like blue shorts, red shirt, red hat. Like you could not have made this crap up. So
wait, they went jogging for their first date?
I think first or second, yeah. Like they met up, like they didn't even know each other. And they literally wore the same thing. So I tried not to use the word cute on this podcast, but that's pretty. I mean, what do you want me to say?
Yeah.
I know. How can you not love that?
And the whole website is just very heartwarming to be at. You see pictures of his family. You get to kind of know him personally and really feel what he's about more than just the medicine. Yeah, he's great he does education for senior patients about cannabis and CBD. He does sexual health for adolescents, and he does it in his own personal style. His patients love him. He's got pictures with people he's been treating for like 40 years all over his office and skeletons and toys. And he lives in Carlsbad, California. So when I was out on vacation, I met up with him. And if you ever have the chance to go to San Diego, just go there and never come back, which is what he did. So coming up after this, we are going to talk to Dr. Jeffrey Pearson of Medicine in Motion from Carlsbad, California. Emmy, I believe, where are you going to today? You got some stuff to do. It's morning as we record this in Cambodia. Yes, I'm going to go learn about malaria.
Malaria. Well, I can teach you. Malaria is bad. There.
Yes, and we're going to eliminate it. So
we are going to eliminate it.
Onward
you
and
me and Bill Gates and a bunch of people, and it's going to happen.
Yes.
All right.
Bunch of governments. Thank you, governments.
Coming up after this, my interview with Dr. Jeff Pearson. Emmy, have a good day eradicating malaria from the planet Earth. What a slow day you have.
Little by little.
Little by little. Welcome back to the Post Call Podcast. I am in beautiful, perfect Carlsbad, California, and I found a guest via our reporter, Doug Brunk, who lives in the area. I thought, hey, Doug, I am in California. I wanted someone to talk to for the show, and he said, I got the perfect guy for you. You need to email this guy, Jeff. So I'm here with Dr. Jeff Pearson, and in his office, I'm looking at toys and magic and all this different stuff. So give me the bullet points of who you are and what the hell is in your office.
The bullet points, my dull, wretched life. I am a family and sports medicine physician, grew up in Jersey, relocated to California in '88, and just trying to live a day at a time.
Yeah, one day at a time.
Yeah.
So we walk in here and you give me the tour, and there's a jackalope on the wall. There are surfboards. I'm looking at different pictures of Elvis, and there's a guitar, and you're showing me all these pictures of doing magic and whatnot. So the reason we found you and how I did research is your website, Medicine in Motion, and that's also the name of your practice here in California.
Correct.
And you have pictures with patients in clown stuff, and you're doing magic tricks to make people feel comfortable. What's the strategy there? When did you start doing that, and what's the benefit of that?
Yeah, welcome to the Department of Phonology, as is
yes.
on the shirts and things.
Take that.
I was always a clown. I just liked...
Literally.
Yeah, literally. I mean, I've had noses. I've done magic and improv and things for years, and so many people are scared when they go to the doctor. And I thought,
Right.
that sucks, you know? You're supposed to be able to really talk to the guy. And I thought, if I do this stuff, they're loose,
Right.
and it works. And I get to hear the real story. You know, instead of them making up a story how they injured themselves,
Right.
they're more likely to actually tell me the truth. Like, yeah, doc, I really was high when I did that, rather than something else.
Right, which that has to go so far in building a lengthy, trusting relationship with
Right.
your family practice.
My patients have been with me for 30 years.
Yeah, I saw some pictures of people coming back and just sharing moments with you. And so give me some
Well, I
examples.
bribed them, but
Oh,
the other
that's
ones
good.
are. I do have people that legit me for 30 years.
So give me some examples of some of the things that you've done in the past. We were talking off camera, or I guess off the mics, about things that you've done. So give me some examples of what happens in the clinic to make people feel that way.
Oh boy, God. Well, as you see around here, we have a guitar, so we'll improvise and write songs for patients. I had a professional singer the other day in here, so I pulled on the guitar and started playing songs, and she sang, and we did harmonies together. Awesome. I have a box over there that's filled with toys that's all used for patient education. So we'll have like sunglasses to talk about sun protection for your eyes, but they're also like Elton John sunglasses. Mm-hmm. So I also have a little piano in there that will play Elton John on the piano at the same time.
Nice.
So we're finding ways to tie in, to make it fun, because you learn if you're having fun. You don't want a doctor to say, well, okay, use your sunscreen, do this, put ice. That's boring. Goes in one ear, out the other. Right. But if you tie it into something, that was really funny, they remember it.
Right.
Go figure.
I imagine that makes them feel, like you said, they're more broken down and they tell you the truth. And clinically, how important is that to get that from your patient and to provide it for them?
Yeah, it's very important, because the patient will tell us what's wrong with them. You know, we just shut up. The other thing I teach my students is that most doctors interrupt after, 7 or 8 seconds, because they have their agenda, their questions. I just say, tell me why you're here, and I shut up. And they will tell you what's going on. And they trust me, and they really will tell me what's going on. And they'll bring up the stuff that they think is important. I'm not trying to put words in their mouth.
Right. And that's got to make them feel so good to be like, hey, this is what's going on with me. Now, as a family practice physician, you see people all ages and different parts of their lives.
Sperm to worm.
Right. Sperm to worm. Love that, because the worm is the dead body. Got it.
Yeah, got it.
That's really great. So the relationships you've had with your patients, you said you've been doing it for 30 years, but what has changed about you, and like how have you adapted your process? Or
Oh gosh, how do I adapt it? I mean, I've always done some stuff. I try not to fall into a rut and do the same thing over and over again. So if I find something new, I'll incorporate that and work into the rotation. My patients, we have a joke exchange program. They all have to bring me jokes. So if I hear a good joke, then that'll work into the rotation for, bore 40 more people with that joke.
I love it. Just stealing material from people as like a mine.
I steal from the best. You know,
great writers work from people.
Well, I work as a bar magician as well at the bar next door on Tuesday nights, and I do improv. And a lot of times I'll be improvising what I'm doing, and I'll get a really big laugh from it. It's like, that's good. I'm keeping that line.
That's a winner. Yeah. So what is bar magic?
So I'm a close-up magician. I'm a member of the Academy of Magical Arts, which most people know as the Magic Castle in Hollywood. So I'm a close-up performer, and if I do close-up behind the bar, because it looks better if you're drunk,
a lot of people do.
That's what I do, and my goal is to make people laugh for 2 or 3 hours.
You did a card trick on me before we turned the mics on that was shaded in hypnotism.
Right.
You made me trip out that Queen of Spades was actually 9 of Diamonds. Now, usually at the poker table, that is a mistake I make often on my own. But that was really fun. I can see how a couple of minutes like that would make me. It would down my inhibitions and make me feel like, all right, now we're on the same page, we're on the same wavelength.
But I also use it for exams. Like if I'm going to check a guy's eye exam,
Sure.
I'm taking a giant coin here,
Yep.
and I'll just go ahead and put it in my hand like that, and they'll think that it's gone. But
Right.
the reality is it's still there.
Right.
So I'll use magic to you obviously can't see it on a microphone,
Right.
but I just made the coin disappear. Or other things we'll show kids like how coins can actually float up, and it relaxes them. You know, they just
Make it feel like
I
part
use
of the team.
sponge balls and other things to teach about cholesterol, allergies. Like I'll pretend this is a sponge ball, so I don't have to go over there. It's just like this goes up my nose like that. I make it disappear. I explain this what happens with pollen and antihistamines, how they work. So I use the magic to teach them about their bodies, and again, they remember it that way.
Right. So, in case anybody out there wants some advice about not necessarily how to become a certified real-life practicing magician, but what techniques can people who are in the clinic use if they're not as into magic as you are or into other things to break down those barriers with patients and kind of
Actually,
create the relationships?
there's a wonderful book out by my friend Scott Tokar and Harrison Carroll. It's called Side FX. It's written for physicians on magic that they could do in their office to help people relax.
to deal with any patients of all ages.
Yeah,
and
it
types.
is.
Yeah, of
It's
course.
mainly for kids, but you can do it for anyone.
Yeah, of
But
course.
it's a great book.
So I wanted to switch gears a little bit, and I always
Sure.
do this. Let's talk about who the hell you are. You were from Jersey.
Joyzy. Yeah.
Joyzy, and
I
then
hide
you
the
went
accent
to
well.
you went to Gettysburg.
Gettysburg.
For what, undergrad?
Undergraduate, and went to my medical school was Kirksville College of Osteopathic Medicine.
Right in the middle of the country.
So-called Mecca for DOs.
Right, which is in Missouri.
Missouri,
Missouri,
right? You said it right.
Thank you. I went to college in the SEC. You're welcome. And then now you're out in, and I am a hyperbolist by nature as a member of the media. Carlsbad is the best place in the world.
It is.
From weather, when
I'm not stupid. I ended up here.
Yeah, of course. Like, listen, when my girlfriend and I pack to come out here once a year to visit family and friends, we don't even look at the weather.
Right.
It's pointless. It's the same thing. Hey, guess what? It's somewhere between 75 and 85, sunny, maybe windy, but not really.
Yeah. Good bike riding wood.
So how did you figure it out?
So after medical school, I practiced in Jersey,
Yeah.
and my father was a physician as well. And I thought, well, I want to prove it on myself. So I did my own practice first, and then after I proved that I could do it, I merged my practice with my dad, and learned that sometimes it's tough to work with family. So rather than move cross town, I went cross country.
Hey, Dad, I love you. For us to be closer.
Yeah, actually, it worked out better that way. It really did.
It's amazing how that happens with people. Yeah.
So I joined a group out here that was sort of infamous at the time. It was called FPA. A lot of their guys ended up going to jail for their medical management things. I got out before that. I didn't have any part of that. But when I was out here for those 2 years, as part of that, I got to meet other doctors out here. And I hooked up with two really good guys, Ron Shimon and Gordon Booth. And I was a sports med guy, and they wanted to do work comp. So I had a great idea. Let's treat work injuries like sport injuries.
Oh, there you go. Because it's like a sport, right?
Right,
It's
the
a
industrial
vocation.
athlete. So we started a place called the Industrial and Sports Medical Center nearby in San Marcos. Did that for about 8 years. And then wasn't given the opportunity to buy into it. I came as an independent contractor. So I basically went on my own again and practiced in front of the Cal State San Marcos University for 15 years. And then about 7 years ago, all of us local private guys ended up joining a large group in the area called Graybill, mainly because all the insurance companies were requiring that we had to do computers and electronics. And as a solo practitioner, I didn't want to lay out $70,000 to $100,000 for a computer system. Graybill said, we'll buy it for you if you join us. We all did it.
Yeah.
And we love it, and they're good guys. But I just finally ended up getting so burned out on the HMOs. You end up treating the medical records. When I finally left them, I was working 9 to 6, usually through my lunch hours. I go home to my wife, say, hi, Laurie, do something with her for 2 hours, and do another 2 or 3 hours of charting. And it just stopped, being fun. I wasn't as jovial. I wasn't filtering what I was saying as much as I should have been, probably, because I improvise. Right. And finally, we just decided to say bye-bye. So I left them in June of last year.
And now you're here in this office that is 50% family practice, 50%.
Well, I share space with a chiropractor. Right. They're two separate offices.
Correct.
And being a DO, I keep my manipulative skills. So yeah, I do diabetics, hypertension. I don't assist in surgeries anymore, but over the years I used to assist on open hearts and brains and stuff.
Sure.
And now I'm just trying to keep it simple. Doing full family practice. I do manipulation. So if you wake up with a stiff neck, I could go and fix that for you.
Sure.
And it's one-stop shopping. And it's great for advertising. How many people like, wow, I don't have to go between these two guys. I go, one guy does it all.
Yeah, that makes it easier for everybody. And obviously, like, anytime you can cut something out of the checklist as a person, that's great. So
that's how I ended up out here.
Yeah, which is, I mean, I love that story. I know that my brother and I, we really butted heads. We're only 14 months apart, but he went to college in northern Indiana. I went to college in the deep south, and then we got really close in college. Hey, the house was a little bit too small for the both of us. So, full disclosure, you were an editorial board member of the Journal of Family Practice Medicine, which we had.
Actually different. I was for Patient Care Magazine.
Okay.
And for medical economics. I was on the board of editors for both of those.
Right, and that's how Doug Brunk, our
Doug,
reporter.
that's right.
Yep. So that's how we know each other, and just get that out there. So we're in Carlsbad. It's all well and good. You are an educator.
Yes.
And you said that after med students do rotations with you, they earn their what?
Their clown nose.
Their clown nose.
Yeah, they have to do that. I train MDs, DOs, NPs, and PAs.
What do you get out of doing that? Like
one, it keeps me fresh.
Sure.
Number two, it keeps me up to date on things because if something new comes out, they'll bring it up to me.
Right.
And it makes my life more interesting too, and my patients like it because I spend a lot of time with my patients anyway. I'm known for that. And when I'm explaining to the patients, the students are learning too because I'm educating them both at the same time.
And how do they adapt to the clown stuff and the magic stuff? And
the patients or the students?
The
students love it. Well, the other thing I do is, when someone rotates me, I explain they're going to learn medicine anywhere. They'll learn some medicine from me.
Sure.
What they learn from me is how to talk to people and how to handle people, how to be their friend, how to be their doctor, but on a one-to-one basis,
right.
How to really get them to open up. I mean, you'll learn how to treat ulcers, you'll learn how to treat this sore throat, but they learn when difficult patients come in. I went to 4 different doctors and they told me this and that, and it sounds like a real horrendioma, and I'll see how I handle it and try to help them muddle through it and make it organized.
Sure.
And that's what they learned from me.
And do you think, how many patients have you stayed in touch with, how many students have you stayed in touch with over the years?
I was at a conference last year, the AOA conference, and a guy came up with me. And he says, you may don't remember me, but I rotated with you 28 years ago, and I loved you. I still remember all this stuff.
Oh, that's really good. That's what makes it really fun.
It is.
You can get, everybody comes from, I know this is, use sports metaphors too much, but you hear the term coaching tree a lot, where this guy learned football from this guy, and then he taught all these guys, where I think medicine is so similar in that regard.
Because now I feel freaking old. So when I graduated medical school and I went to my first medical conference, you wear your little labels, introducing yourself, and they have PGY like 1, postgraduate year 1. So I was PGY 1, and there are people there with PGY 25, and I'm thinking, God, they're old, and now I'm PGY 35, and it's like, shit.
Yeah, you get your plaque in the mail.
Yeah, it's like
35 years.
It's like, damn, I'm there now.
So we talked a little bit off mic that you said you burn out, you moved to California, you do all this stuff. Let's talk about the burnout.
Burnout is so much fun.
Yeah.
I burned out twice. The first time was when I was doing the industrial sports with my friends, because we did work injuries, and I would see things 40, 45 people a day. Now, they weren't all new injuries. Some of them were follow-ups.
Sure.
But if you work hard and I mentioned that I wasn't allowed to buy in, so I was getting just a paid, a certain amount. And if you work hard, if you get rewarded for it, you do it. But if you just feel like you're working hard and you're not getting that, it's like, why am I doing this? And it was easy to burn out. And it showed, and my partners came up and said, look, you're going home for a week. Just get out of here, clear your head. Best thing they did for me. I got out of there, came back renewed.
Yeah, that's good to have coworkers like that.
Yeah, and the last time was what I mentioned earlier when I left Grape. I was just dialogue box. The doctors I worked with were great. Sure. But it's like, you're not treating patients.
Right.
So
what do you think because burnout is obviously, I mean, you've experienced it's systemic, it's everywhere. And it's, like you said, we've had different doctors. Dr. Eileen Barrett just said straight out when we interviewed her, it is the EMR. The EMR
it is. I found an EMR that I could use in a small practice called Dr. Chrono, because it does what I wanted to do. I just want to take notes. I put subject, what they tell me, object. I write a note. Yeah. It's a note.
Like it's a note.
You can read it.
It's done.
I teach my students to think notes like storyboards in movies. You don't get like every word, but you want your note to convey what really happened during the session. So here's a thought here, a thought process here, and how they all connect, rather than trying to get every little word.
Right, like a comic box.
Yeah, exactly. That's exactly the way I teach them how to do notes. And I could do that with Dr. Chrono. I could just type. So when people look at my notes, it's like, I know exactly what's going on. There's not that extraneous stuff where you're just putting on to cover your butt.
Yeah, that's a good point. Yeah. I think that's such a tough thing. Okay, so a couple other things I want to get into.
Good.
I want to get your take on two things that are tough conversations that people are having in their own daily lives, and I imagine physicians are having with patients. The first is we'll come back to this one, which is marijuana and CBD.
Sure.
And the second one is I can imagine children playing football.
Okay.
Is that a conversation you have with patients? Like,
Yeah, I do. I might talk about all these.
Yeah. Should my kid be allowed to play football?
Pop Warner, sure.
Yeah. So what do you go through it? When do you think they should be allowed to? What to look out for, and how can parents make it safer?
You're dealing with lightweight kids. I mean, you're talking about Pop Warner versus high school versus which level, and you want to try to. The idea is to try to keep the sizes of the kids, which is more of maturity relating rather than age. You know, you just want to keep like because then they're less likely to hurt each other.
No one's dominating someone else.
Yeah.
Right?
So I mean, I like it. I liked when we grew up. Now it was different when I grew up. We did every sport. We did football, and then cross country. Then there was wrestling, and then basketball, then soccer, and baseball. You did a different sport every month,
every season. Yeah.
Now you have all these people just doing one sport only, and when it's boring. Number two, they get overuse injuries because they're doing the same thing over and over again. At least when you vary the sports, you were
working on a different muscle group, and
yeah. So I love sports. I want people to stay active. My practice is medicine in motion, which is basically the definition of sports medicine. Sure. We're trying to keep people moving. Now, you have to be an athlete. If you're 72 years old, I want to keep you moving. That's like with the sharks. They stop moving.
Yeah, live your life, man. You gotta get out there and live your life. So let's talk about marijuana. You and I talked about it before we turned the mics on.
Sure.
It's CBD. Legalization, it's all out there. Nobody seems to have any specific answers. And you were saying that there are some organizations that don't necessarily want people to talk about different things. We talk about this in our sister show, Blood and Cancer, about what to do when you've been diagnosed and what to tell patients. So what is your take, and what do you tell patients about A, CBD, and B, marijuana?
Okay. So first of all, I want them to understand that it is helpful. It's been used as a medicine for thousands of years. And they basically went illegal because they want to put people in jail.
Right.
I mean, that's really what it came down to. CBD by itself is certainly overhyped. It's overhyped because they can overhype it because it's legal. There's nothing to do. Every corner 7-Eleven gas station has CBD, and of course their CBD is the best.
Right.
And my CBD was from Israel. My CBD was there. You ever tasted CBD liquid in your mouth? It's like liquid wood. It tastes like crap. Yeah, no. But people will do anything if they think it's going to help them. If they can rub it on here, they can rub there. The fact is, there's a lot of chemicals in cannabis, in marijuana, hundreds of them. And they work better together as what they call an entourage effect. So CBD works better if you have THC, along with terpenes and all these other things that are in there. So the goal is to get people, to educate them on that, what's the best real cannabis to use. We teach them about strains, about sativa, keeping people more awake, indica, short for indica couch, what a hybrid is. I teach them about from inhaling versus edibles, what's appropriate for them. More importantly, it's dosing. I think it's important that they get information from a doctor rather than an 18-year-old Budmeister. You know, I have a 72-year-old woman with bad arthritis. She's taking Norco, and she's going to trust an 18-year-old. Well, I think for your condition, you should take this Girl Scout cookie and mix it with this. I was like, no, I rather than learn it from a doctor who really knows his stuff. Yeah. And there's a lot of good references out there, a lot of good books written by physicians for physicians on medicinal cannabis. But I also just happen to have a lot of personal experience in the past. My patients assume that I'm high all the time. I'm not. I rarely smoke at all, but I do like growing. I love the smell of it. Yeah. And I know it. I know the chemistry of it. I know what it's good for.
Well, that seems to be the important part, because it seems like a lot of people are acting like they do, but they don't.
Yeah. There's certain people that shouldn't. Like, for example, you should never really give kids chronic marijuana under the age of 21, 22, because it shows it impedes their development. On the other hand, if you have certain seizures, there's Rick Simpson has been helped with those kids, but there's so much stress out there. Turn on the TV and we're bombing this. The economy's going here. I can't afford this. Everyone is highly stressed, and then they turn to their Ambien for sleep, or their Valium or Xanax. And I'd much rather them have just do something natural, like a low dose edible.
Sure.
It's safer.
So here's my question. I always talk about this because I find it I mean, as a big sports person myself, that some athletes without an elite high level of education do have an elite high level platform, and they have the opportunity to pitch different products. We've seen a lot of former hockey players and football players and gymnasts pitching CBD and saying that maybe this worked really well for me. I smoked weed before and after every game, et cetera, et cetera. But how important is it to separate this highly famous person who said it works for me with what would work on a daily basis for someone in your clinic?
That's the basis of all advertising anyway.
Right,
You know, I bought this, I'm drinking this beer, I'm doing it. It's
Smoking, it's sophisticated.
that's a whole other thing about the education of America and dumbing down of America. I mean, you like to hopefully think that, realizing that, okay, he's being paid to do that.
Right.
People are certainly swayed by it. That's why they do it.
Right. Yeah.
So
And
my job is sort of sometimes to counteract that. If someone thinks something is really too good, it may really be too good, and I have to burst that bubble, but I want them to get the facts.
Right. I came up with a policy for myself after watching the Firefest documentaries. I call it "That Girl Doesn't Like You." And so you get these Instagram models who are posing provocatively, and they're saying, come to this festival, and like whatever. Like whether or not, regardless of your gender, that model does not like you. They're not going to make out with you if you go to this fire festival. Someone wants your money. And that's true for all of these different things, I think. And I think that's happening a lot in CBD when you hear the retired hockey player say, I used it and it helped me. Like, that's great, but this is not based in science, and you're making a lot of money and you own the company. And so I think
just watch any late night advertisement. There's a famous spokesperson. Hi, I use this Medicare insurance supplement. You should too.
Right. So what do you say to patients who bring that kind of thing up? How do you counteract just these anecdotal advertising?
Well, I'll tell them the fact. We'll talk about what their conditions are. Have there anything been shown to help those conditions? And then teach them how to dose it properly and how to learn to get stuff that's analyzed so that you know what you're really getting. Right. I just try to give them factual information.
Yeah, I mean, I guess that's all you can do. So your website, Medicine in Motion, is available, of course, in the podcast notes. And I don't love the way this term is thrown around, but I do like it in certain instances. You have a brand. Like, I know what to expect with you. Your website matches your personality. Your practice matches your website. Everything is tight. What do you think is the future of what's? Yeah, absolutely. Just got up and show me your shirt. What's the future of medicine as far as what you see it in family practice?
Oh God, all right, we have an hour.
5 years, 10 years.
I mean, as one who jumped ship from all the insurance companies, I would love to see single payer. I would love just to see not have to worry about insurances, anything whatsoever. I did some volunteer work in Canada. I take the kid to the hospital for emergency. Showed him the card. He was right in, got seen, got a scan and everything. Yeah. None of that, like, oh, wait here, I got to call to make sure insurance card is good.
Right.
I think would save us a lot of money, save me a lot of money. I'm paying $20,000 a year for health insurance right now with a high deductible, which means I pay everything cash. I had my knee scoped. Most of it I paid for cash. Wow. Okay. I would much rather pay $20,000 extra in taxes instead and have everything covered. Right. So the money's there. And it's just, So I would like to see that. People just practicing medicine.
Right. Yeah, no, I think that would be obviously really big. What about in education? You've been educating for decades, and so how are things moving, and where do you see the future of hands-on education?
I don't have many thoughts other than just trying to tell what I do. I try to teach how to be human. Right. I try to be not the HMO or anti-insurance, but I want them to treat patients and not treat the insurers or treat the EHRs. Sit there, look at your patient, look them in the eye, and listen to them. And be in the moment, be real. Don't go there with just an agenda. I got to get this point out. Just listen to them. I want them to be real with their patients. Yeah. I want them to be real doctors and real, family doctors. Be family with their patients.
Yeah, which is sort of the opposite of what artificial intelligence and algorithmic diagnoses and things like that. It's just like real human connection.
Well, some of the schools are doing that. Like UCSD set up a program where they'll farm out their first and second year medical students with physicians so that they do get that clinical training. When I was at Kirksville I graduated in 83, we did cold rural clinics where you were the physician for a rural clinic. You may or may not have another doctor right there with you, but these are underserved areas, and you did it. You learned how to be comfortable with patients as a student.
And those patients needed that.
Right, they needed it. And we had people we could check with. And then when I went to my residency and with MDs that didn't have that, I felt really comfortable talking with people and doing things, and they were kind of like really skittish.
Because they don't have an experience like hands-on like you did.
So the idea, but like I said, UCSD is trying to do that. I'm sure other schools are doing that now. But get them clinical where they're really seeing how to talk to people, really how to deal with real life people.
Yeah, and I guess that's something that it's obviously so important. You're treating patients.
Yeah.
Your
I mean, I
doctor,
won an award for this like years ago. In 91 was the Patient Education of the Year, Society of Teachers of Family Medicine and stuff.
Yeah.
And the people who went to that meeting were really good with that, but there's other people that...
Yeah, everything's trendy and new stuff and all that. That makes sense. So as someone who, you said you burned out twice and it was really clear to you the solution was, the first thing was that you had people around you that noticed and wanted to help you out.
Right.
And the second time was you were self-aware to say, this is the problem. I know the problem. I need to get out of here. But other people right now, and like I like to think that this podcast is part of that, like the solution, and give people a place to empathize and feel good about themselves. How important is it to surround yourself with the right people, A, and B, know when you have a problem?
Yeah, you want to be happy. You don't want to, if you're just working for money, and especially if the money's not there with the cutbacks, then it's a job and it's not fun.
Sure.
I do improv comedy as well, and I look at every day as an improv, and every day is different. There's also that virtue of family practice. If you hate pop quizzes, the last thing you want to be is a family physician, because I don't know what's in the room.
Nope.
It's like this. Versus if I just had the same hypertension every day. Where was I going? Yeah. Don't get old. It sucks.
Yeah, I can't even imagine. You just where were you going?
Yeah, I was going to Hell in a Handbasket.
Hell in a
apparently.
Handbasket.
So about improv and things.
How important it is to surround yourself with the right people.
Well, yeah, and don't hang around with people that are jerks. I'll keep it clean. Before you're so depressed, make sure you're not hanging around with people that are sucking the energy out of you. If you're always in a situation, and the same counseling I'll do with patients is, don't keep yourself surrounded by a toxic environment. Right. Although I do use improv for teaching my patients how to cope with stress. The basic tenet of improv is yes and. Right. If you're watching two people on stage, first one goes up there and says something, the second person agrees with the premise, in essence saying yes.
Continues.
And then they add to it, right? So let's say I'm going up on stage, I'm thinking I'm a hockey player, and I'm carrying my imaginary hockey stick. But you call me a mad scientist. I don't go, stop, see, hockey stick, because that stops the game, right? But if I go up there, think I'm a hockey player, you call me a mad scientist, I immediately agree with what you said. I go, yes, I am a mad scientist. I'm going to take the brain of this gorilla and put it inside of this hockey player. Yes, and then you say, yeah, and then we'll do the Olympics. And and it's a dance. Now, in improv, sometimes you get good suggestions, sometimes you get crap. Either way, the game is going on and you have to deal with it. Such is life.
Love it.
Improv teaches you to be in the moment and to honestly respond to something, truthfully. And the same thing in life. You have to, I got a flat tire on my way to the airport 10 years ago. I could have bitched and moaned. Instead, I said, look, I have a flat tire. It's not going to fix itself. I fixed the tire. I barely made the plane, actually, by the way.
But you did.
I made the plane. But that's the thing. Is like, I didn't plan on the flat tire. I didn't want it. It happened. You got to deal with it.
Yep.
And the game is moving on.
Absolutely.
And so life is basically an improv.
So you are Dr. Jeff Pearson, and your website is medicine-in-motion.com. It's available in the show notes. Anything else you want to say before we get out of here?
No, thanks. I appreciate coming down by.
It was a great conversation.
Hope you had fun.
Oh,
Enjoy
absolutely.
the music.
Well, first of all, so we're staying in a little bit, I guess, south and west in Vista. So anytime we get to Carlsbad, obviously got to take advantage of that. And big thanks to MDedge reporter, all-star Doug Brunk, for putting us in touch.
Hi, Doug.
Hey,
shout out to Doug.
Huge shout out to Doug. Dr. Pearson, thank you so much for coming on the show.
Pleasure.